Hey everyone, I'm back for the second video in my series. Today is Thursday, September 5th, and I had my pre-op appointment with my surgeon today down at University of Chicago. As you can tell, I had my hair cut since the last video too. I'm figuring I want to go into the surgery with as much ease as possible, so I don't want to have to worry about my hair being too long when I'm in the hospital and all that kind of stuff. I wanted to clear something up from my last video. In my last video, I referred to a previous video because my plan is I'm going to make a video giving my entire history with my colitis and my primary sclerosing cholangitis, how I was diagnosed, when it happened, what was going on, and then my progression with the disease. So I'm planning to do that and sort of make that the first video and then lead into my experience and process through this colectomy surgery. But of course I haven't made that video yet, so that will be in the future. But anyways, the purpose of this video today is because I wanted to describe a little bit about my pre-op appointment today with my surgeon, who is Dr. Hurst, by the way, at University of Chicago. Most of my ulcerative colitis follow-up and my initial liver diagnosis follow-up has been at University of Chicago. And I've been extremely happy with everyone there. My pre-op appointment today, I was there about 3.5 hours, and I was probably only alone in the exam room, maybe a half hour or 45 minutes at that time. The rest of the time, a nurse was in there, or the surgeon was in there, or the ostomy nurse was in there. They just spent a lot of time with me, answering questions. Dr. Hurst seems like a phenomenal man. He sat down, answered questions, was not in a rush. I've heard great things about him. The term artist has been used to describe him as far as when he's doing surgery. So I think that's probably the most important thing, is if you are considering surgery, do research online, talk to people, find the top people in the country that are doing this, because you want the best possible outcome that you can have if you do decide to go the route I'm going in the end, to have the internal J-pouch procedure. You want everything to be in your favor, so there's no leakage issues, and no added problems down the road. So really do your research, and you really want to be comfortable with the entire staff. The physician's nurse is basically going to be with me, she said, my entire life, or as long as I'm here, because she follows all the patients that have the J-pouch procedure. The same thing with the ostomy nurse. Those people are going to be working very closely with you. The ostomy nurse may be short-term or long-term. If you have a permanent ostomy, of course, the ostomy nurse will be with you longer term. In my case, hopefully she'll only be with me between 6 and 9 months. But as I said, it was a good experience. Make sure you feel comfortable with everybody, that they're good support. I had one instance of breaking down in the office today with the nurse, just asking her if she thought I was making the right decision, because I still am battling a little bit with it, because it is hard when you're not sick and it's not an emergency. And she was able to talk me down and walk me through it. And I think that's probably the most important thing, because this isn't a light surgery. I was describing to one of my friends on an email today, I think what I'm having a hard time now with is the finality of it all. I'll go to sleep Monday morning one way and wake up later Monday a completely different person, with new challenges to deal with. So I think that's probably the hardest part about everything. But I know I'll get through it. I'm not the first person, I won't be the last. And I know I'm following stream of consciousness thought when I'm talking. It's very emotional, and What I've also found is, since starting this video series and emailing friends about what I'm having done, really use your friends and family as much as you can. I tend to play things pretty close to the vest, not super talkative about everything. I internally process a lot of things, but your friends and family want to know what you're going through and how you're feeling and the exact procedures and things that will be done, because if you don't talk to them, a lot of people don't know that how big of a procedure this is, and they want to be involved. They want to know what they can do to help, and so don't close them out. Make sure that you utilize them as much as you can, because they're going to be very important, and I see that more and more as things progress. But I digress. So back to the appointment, my pre-op appointment today. The surgeon came in and described things to me. There's usually two options they can do when they do this procedure. If you're going to have a J pouch as the final result, which the J pouch is the internal pouch, which will allow me to go to the bathroom pretty much typically the way the rest of everyone goes, sitting on a toilet, albeit it'll be more frequently, the consistency will be different, but I won't have to have an ostomy bag. They can do the procedure in 2 steps or 3. The physician prefers to do it in 3 steps for people that have been on immunosuppressives because of the issue of the tissue healing. So I'm going to have mine into 3 separate procedures. During this first procedure, they're going to actually remove the colon. They're going to bring the end of the small intestine up to my abdominal wall and create what's called an end ileostomy. That's where the bag will attach to collect the waste. And they'll actually leave the rectum intact during this procedure. And the physician said the first and third surgeries are probably going to be the easier of the 3, the first and third. And during the second procedure, what they'll do is they'll go in and they'll actually remove the rectum. And the physician talked to me a little bit. There's, I guess, 2 different procedures when they remove the rectum. They can completely remove the rectum and all the tissue and attach the small intestine directly to the anal canal and actually go in and hand suture that together. And they've removed all rectal tissue that would be remaining. There's another procedure, and during that procedure they have to do that open, which means they have to make an incision in your lower abdomen to get in. The first procedure will just be done laparoscopically as long as everything goes okay, so there wouldn't be a big incision to heal on the first surgery. But the second one, if they go in, when they remove the rectum and hand stitch the intestine to the anal canal, they have to do an open procedure. The other option on the second surgery is where they would go in laparoscopically and they would still leave part of the rectal tissue. I'm not exactly sure what part. Again, it was a lot of information to try and remember. But they would leave a little bit of that and then they would suture, but not hand sew that together. And I guess that still leaves you with a little bit of risk of colon cancer because there is still some colon and rectum left in there. So I, of course, opted for the open procedure where they will completely remove the rectal tissue and hand sew things together. Because one of the reasons I'm doing this is because my incidence of colon cancer is basically about 25%, now 1 in 4, because I have the 2 different diagnoses, the colitis and the liver diagnosis. So that's the second procedure, and that is a minimum of 3 months after the first procedure. And then the final procedure is when they go in and they take down the ileostomy and they basically open the plumbing and let things flow, as it were, and hopefully everything goes well. Also during the second procedure, they take, because from the first procedure your ileum is attached to your abdominal wall, the end of the ileum, they actually in the second surgery take that down and that's what they sew to the anal canal. And then they take the middle part of the ileum and they put a cut in it and they bring that up to the abdominal wall, and that's termed a loop ileostomy. So your ostomy actually changes in the second surgery from the first. And the ostomy nurse did tell me sometimes the loop ileostomy areas coming out your abdominal wall can be a little bit harder to fit with your ostomy bags, but that's obviously something we'll adjust to as we get there. Also, the surgeon said there's a phenomenon called ileus, which basically means the motility of the small intestine stops. And he said it happens to everyone after surgery where they disrupt the small intestine. And everybody's different in how long it takes for that ileus to resolve. And you can't have any food or liquid while your small intestine is not moving. So you have to wait, and that's basically what takes so long with the hospital stay, is you're waiting for your small intestine to wake up. And basically what the ostomy nurse said, you know it's woken up when your ostomy starts passing gas. So basically, I guess your ostomy is farting in the back. But once that happens, that's good news, and that means you can start taking water in and things like that. So I could be in the hospital anywhere from 3 to 7 days, depending on how things go. After this first surgery, of course, I'll have a Foley catheter for urine, and also what they call a rectal tube. Yep, just like it sounds, a tube up your butt. Because once they seal off the rectum, there can be pressure buildup in there, and they don't want that to happen. So the rectal tube helps relieve some of that pressure, and that should only be in a couple days. And pretty much that's what I'm in for the next 6 to 9 months. But I felt a lot better after talking to the surgeon and the team there, the nurse, the ostomy nurse. It was a good experience, as good as could be. And then at the end, I met with the ostomy nurse who came in and talked to me a little bit about the ostomy and the bags and things, and she actually gave me a bag. This is what they look like. And then before I left, she marked on my abdomen where the bag is going to go. And I won't go in this video on the whole process of sizing the bag over your ostomy site and all that stuff. I don't really fully understand it right now anyways, but I'll get there. She said she'll be in to see me in the hospital the day or two after the surgery and make sure that I can at least empty the bag before I leave the hospital. And even if I can't change the bag, which they recommend every 3 to 5 days, I'll have an ostomy nurse come to the house still to help me until I can learn how to change it myself. So now we're on to the R-rated part of the video, because I'll actually show you where she marked. This is it right here. And actually what happened is, on my way home on the train, my belly got sweaty. And there was Tegaderm, or a coating over this to try and keep it so it didn't rub off, but that got wet and then it all ran. So I had my first issue with my ostomy, and I don't even have one yet. But anyways, this is the mark where they're going to put it, and she made me do all these bending exercises and everything to make sure it's in an area that doesn't have any creases. So basically this bag will fit right over here. And this will be where the poop goes. What I didn't realize is that actually you can sit on the toilet still and just open the bag. I'm not so good at it yet, obviously, because I just learned it today, but it unrolls like Velcro, and then you just drain it out, and then you wipe inside, and then you just fold it up and seal it back together. And that's it. This bag is actually see-through, but they do have bags that are opaque, so you can't see through them. And there's all kinds of belts, I guess, you can get that, you know, so if you want to go swimming and things like that, and you're very active, or for those intimate moments, where it's just like you have a black belt or a back brace around your belly without having to show the bag. So pretty much that covers everything that I learned today, so you're up to date now on that. I got all the information on the prep. There's 2 days worth of prep, basically where you're not eating before you go in for surgery. And that's it. I'm hoping to maybe make a video of me, obviously not during prep day, because I don't think anybody needs to see you pooping on the toilet. We all know what that looks like. But I may try and have my partner videotape like the morning of surgery and going to the hospital. I think once I leave the waiting room to go to surgery prep, I don't think my family and partner will be able to see me anymore. So I'm probably going to have them videotape me after they take me to my room, and when I first get a look at my ostomy and things like that, because I kind of thought it might be important for other people to see someone's reaction for the first time seeing themselves with an ostomy, whether it's going to be tears or fear or laughter. I don't really know yet. Today my emotions have kind of been all over the place, just for no reason. I felt like I'd break into tears for 15 seconds and then it'd go away. Just really weird how we work through the process of our emotions with everything. So I think that's it for now. I'm gonna try, like I said, to make that video of my history so people at least can see how I got to this point. And that's it for now.